Robotic surgery is one of the most recent innovations in the spectrum of minimally invasive surgery in cancer care. So let's discuss and know more about robotic surgery in the management of endometrial cancer in today's episode. Hi, this is Dr. Lakshmi and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. Joining the discussion today is Dr. Rajesh Goud, Consultant Surgical Oncologist and Robotic Surgeon from Yashoda Hospital's High-Tech City. Welcome to the program, Doctor.
Hello.
For the longest time, endometrial cancer remained in the shadows in India. So to begin with, what exactly is endometrial cancer and what is the burden of this disease in our country, Doctor?
Endometrial cancer is the cancer which affects the uterus inner layer. So uterus has three layers will be there. So inner endometrial layer and in between myometrium and last is the serosa. So all the cancers arising from the inner layer called endometrial cancers. Previously, if you take the uterine cancer, cervical cancer was more burdensome than compared to endometrial. But recently, there is an increased trend in endometrial cancers. So obviously, the burden of endometrial cancer is expanding, and in future also it will be more. We'll see a lot of endometrial cancers.
So as discussed earlier, there is significant rise in patients detected with endometrial cancer. So what are some potential risk factors associated with this and which age group is affected the most, Doctor?
This increased trend in endometrial cancers is because of most westernization. So the way we are eating and the dietary modifications and so increased obesity, increased hormonal imbalances, what we are seeing regularly, and increased incidence of a polycystic ovarian syndromes where there will be abnormal excessive estrogen compared to progesterone levels. Because of these imbalances in hormonal levels, females are prone for endometrial cancers, and 10% of the cases there will be genetic predisposition will be there. And majority of the endometrial cancers we will see in the postmenopausal age group after 50 years. But recently there is an increased trend in less than 40 years also we are seeing good number of endometrial cancers.
So once a patient is diagnosed and staged with endometrial cancer, what is the latest treatment modalities for this?
Previously, up to 2022, the classification what we used, the FIGO classification, now it got updated in 2023. According to it, there are a lot of modifications are there and better understanding of the tumor biology. If now the present the treatment is more of a personalized treatment, so it's not a conventional staging. Apart from it, it will include molecular markers and genetic analysis and immunohistochemistry. These things will take and we will precisely identify what type of treatment needed for the specific patient, and then we'll treat accordingly.
So discussing about some recent advancements in the treatment of endometrial cancer, what exactly is personalized care in oncology, Doctor?
As I told, there is a lot of understanding of the tumor biology, particularly to the endometrial cancers. So these days, apart from the conventional histopathology, what we advise to go for a genetic analysis and IHC testing. So majority of the endometrial cancers, previously what we used to have stage 1 and stage 2 cancers, maybe got over-treated or under-treated. And depending on the patient characterization, like histopathological characterization, apart from IHC markers and genetic analysis like POL mutations and P53 mutations and all that, these will further categorize the patients into a high-risk category and low-risk category. So even stage 1 cancers who are high-risk category, we will treat them with chemotherapy or radiation treatment. Whereas stage 3 cancer, it looks like advanced cancer, but it's less aggressive variant. No need to go for any further treatment. So that's what the personalized treatment means. So depending on that situation, that person, that histopathology and biochemical markers and IHC panel will decide the further treatment particular to that patient. So overall, ultimately, the goal of a oncology and onco surgeon and any oncologist is to give a best cure with a relatively good cosmosis.
So you've mentioned about robotic surgery as well. So are there any particular advantages that a patient would be having when undergoing treatment with robotic surgery, doctor?
Conventionally, all the uterine cancers and we used to treat with an open surgery, but with the advent of robotic surgery, usage of this technology has made things easy, and it's highly beneficial for the patients and as well as the surgeons. So in robotic surgery, what we do is we make a small cuts of 8 mm, and we introduce the camera and other instruments, and we remove the tumor completely with ultra precision and less injury to the surrounding tissues. So obviously the quality of life and quality of surgery will be more with a robotic surgery. And one thing, these endometrial cancers are also called good cancers because they will have a very good survival. So when there is a very good survival is there, it's obvious we need to give a good quality of to the patient. So obviously the robotic surgery is preferred over the conventional open or laparoscopic surgery. And one more big advantage of a robotic surgery, in particular in endometrial cancers, is the staging for the lymph nodes. So previously we used to do a lot of complete pelvic lymph node dissections and parietic dissections, but with this technology, we give a ICG dye into the cervix and we identify the nodes. So this is called sentinel nodes. So the node which has spread, is there any spread of the cancer in that sentinel node? Then we'll see with the pathology frozen section, and if positive, then only we'll do the conventional complete pelvic lymph node dissection. So obviously the morbidity of the surgery will be lessened in majority of the cases.
So that means shorter stay in the hospital, fewer complications, and also getting back to routine would be some advantages for the patient, especially with robotic surgery.
Yes, definitely. All my patients who underwent a robotic radical hysterectomy, usually they will be discharged within 24 hours. So the average stay in the hospital will be at 24 hours maximum, and can go to work within 4 to 5 days. The pain will be less and blood loss will be less, and a recovery to work and recovery to home will be very fast compared to a laparoscopic surgery.
I think that's wonderful. So are there any common myths which are associated with robotic surgery? Because I'm sure not many are familiar with this.
So previously, when there is initially, the first myth is whether the robot does the surgery. So that is the biggest myth. So what I clearly tell that robotic arms we use to do the surgery. So we introduce the robotic arms, and that arms will be under control of me and operating surgeon. So we precisely use that arms to remove the tumor completely. So, and second, there will not be any tactile feedback. I mean, in conventional surgeries, క్యాన్సర్ని ముట్టుకొని చూసి ఎక్కడి వరకు ఉంటుందో అక్కడ చూసి దాని తర్వాత ఇద్దాము అన్నట్టుగా అనుకుంటారు. బట్ వాట్ వీ డూ ఇన్ రోబోటిక్ సర్జరీస్, వీ సీ ద టిష్యూ అండర్ మ్యాగ్నిఫికేషన్. 10 times of magnification we'll see. So we see better. So obviously the cancer tissue we can identify very easily, and we will go away from the cancer tissue, and along with the surrounding tissue we can remove the tumor completely in toto without compromising on the oncological outcome.
So before we wrap this episode, doctor, is there any message that you would like to share with the audience, especially robotic surgery for uterine cancer is concerned?
As there is a increased trend in the diagnosis of endometrial cancer, I always advise to get evaluated by a gynecologist whenever you find a vaginal bleeding or abnormal bleeding. If at all get a diagnosis of endometrial cancer, don't worry, it's a very good cancer. So they'll have a very good survival. So provided we get a proper treatment. And obviously I told the surgery, we prefer going for a robotic surgery because the quality of life will be excellent. And it's one of the curable cancers we encounter in my surgical practice.
So thank you, doctor. It was wonderful having you here on our program today.
Thank you.
So this brings us to the end of this episode. Don't forget to join us for next week as well for more insightful episodes on Yashoda Health Talk session. Until then, take care and stay healthy. Thank you.